Are we overprescribing testosterone in middle-aged women? According to this article from The Guardian that came across my desk this week, we are. And it goes as far as to say that our prescriptions are quote unquote out of control. I think that's a little aggressive. And I also think that this article is full of a lot of false information, as well as some things that we actually should be watching out for as a community. So I want to digest this with you guys. I think that articles like this really not only set back the field of women's hormone replacement therapy, but they also set back the field of men's hormone replacement therapy. And I'm going to talk about why. So the very first thing that the article goes on to say is that there's no data for giving testosterone in women outside of hyposexual desire disorder or low libido when, and only when, a woman has failed estrogen and progesterone therapy. Wow. It's things like this that keep women stuck in their medicine, that keep women stuck where they are and get them bad care. What we know is that testosterone does take a steady decline in the majority of women as we age. It does not take that sharp jump off a cliff like estrogen and progesterone does, but it does steadily decline. We also know that younger women have more testosterone than estrogen at any given time if you were to put them in the same measuring stick. And we know that healthy levels of testosterone help us with things like cognition. They help us with things like mood. They help us with things like muscle mass. They help us with bone mineral density. And they help us with maintaining our metabolism, which we know puts us at a lower risk for a whole bunch of other things down the line. Things like sarcopenia, which is the loss of lean muscle tissue as we age, is a huge problem in both men and women. And we know that experiencing that loss of muscle mass really impacts our ability to live a healthy, long, full life and actually a good quality of life, and also puts us at a greater risk for a bunch of increased health ailments as we age, and it's within our control. And so by not looking at the full picture, what we're doing is we're minimizing the care that people can get to maintain their health long term and to really impact their quality of life as they age, which is a problem. The article goes on to talk about overprescription. Particularly, it starts to talk about overprescription in women, which we will talk about in a second, but it goes on to talk about overprescription in men. And it says that men who are overprescribed testosterone get cardiomyopathy and cardiovascular disease, more or less saying that testosterone will cause cardiovascular disease. And this is a myth, and it's a myth that is still perpetuated in the hormone community, and it sets back testosterone, it sets back men's care and women's care. So here's what we know. Properly prescribed testosterone, please note, I said properly prescribed testosterone will actually decrease cardiovascular disease long term. And so this is a really important thing for patients to know, because when they read articles like this, what ends up happening is they get scared and their provider gets scared, and then the patient doesn't get the care that they actually need and deserve because of this false information that's going around. Then the article goes on to talk about all of these women that have been overprescribed testosterone and how we're running testosterone in women and they have the levels of men, and how they're having voice changes and all of these other side effects like hair loss. And you know what? I wish that I could say that I disagreed with this part of the article, but it's something that I see in my practice. Here's what I disagree with. I don't think that this has anything to do with too many women getting testosterone. I think this has to do with providers who don't know what they're doing, taking a weekend course and then giving too much prescription because the pellet company that sells the pellets told them to. The way that we combat this is better education for providers. And I do think that there's an education that goes into the community, right, on signs and symptoms that you're being overprescribed, or on how to pick a good provider, maybe, things like that. Because I do see this in my office. I wish that I could tell you that we don't have patients come in where I look at their testosterone. I think, oh my goodness, this is ridiculous. But it happens a lot. And almost always it's a provider that has, like I said, taken a weekend course, doesn't really know what they're doing, and then is prescribing. Spoiler alert though, this doesn't only happen on the female side of medicine. We see it all the time in men's testosterone clinics in our practice. And so I think by making this into just a female issue, right, that way too many women are being given testosterone inappropriately, is ridiculous. And it's taking it way too far. And so what we need to be doing is having a conversation about healthy dosing and healthy prescribing. And we need to stop scaring men and women out of getting hormone replacement therapy, because we know that this is one of the things that can really impact our longevity and our health long term. And why wouldn't we want that if it's safe in your individual case?